Greetings to you all. Today we are going to discuss median and ulnar nerves. Intended learning outcomes. By the end of this lecture, you should be able to identify the root value and the origin of the median and the ulnar nerves, describe the course and branches of the median and the ulnar nerves, predict the effects of injury of such nerves. Let us revise together or have a quick look on the brachial plexus. This is the mode of formation of brachial plexus. As you all know, and I'm just going to concentrate on that, that each trunk, upper and middle and lower trunks, will divide into anterior and posterior divisions as it shows here. Now, why does this happen? Notice that each trunk divides into anterior and posterior divisions. The anterior division supplies the anterior or flexor surface of the upper limb, both muscles and skin, both motor and sensory fibers. Also, the posterior division of each trunk will supply the posterior or extensor surface of the upper limb, also both muscles and skin. Now, conclusion. Let us see the left side of the screen. Since the medial and lateral cords arise from the anterior divisions of the three trunks, therefore the anterior or flexor aspect of the upper limb is supplied by the three terminal branches of these two cords. Musculocutaneous nerve, which is the terminal branch or continuation of lateral cord, ulnar nerve, which is the continuation of medial cord, median nerve, which receives contributions from both medial and the lateral cords. And since musculocutaneous nerve will be supplying only the arm, so we can expect that the ulnar nerve as well as the median nerve, they begin to give their branches from the forearm and downward. On the other hand, let us look to the right side of the screen. Posterior cord arises from the posterior divisions of the three trunks. Therefore, the posterior or the extensor aspect of the upper limb is supplied by the branches of the posterior cord. The continuation, mainly the continuation of the radial nerve, continuation of the posterior cord, which is the radial nerve, will be supplying the back or extensors of the upper limb, both sensory and motor. Let us begin our lecture, median and the ulnar nerve. Let us begin with the median nerve. Now, the origin. The origin of median nerve, we mean by the origin both root value, which comes from all the root value of the brachial plexus, C5, 6, 7, 8, and T1, and it originates from the two cords by a branch lateral root of median nerve from the lateral cord, which takes the root value from C5, C6, C7, as well as the medial root of median nerve, which comes from the medial cord coming from C8 and T1. This medial root of median nerve crosses in front of the third part of axillary artery in red here, and the median nerve, once it is formed on the lateral aspect of third part of axillary artery, and then it continues on the lateral aspect of the brachial artery. Now let us see the course of the median nerve. let us look to the diagram and see the arrows and the writing on the left side of the screen. We agreed that it continues on the lateral side of the brachial artery till the level of insertion of coracobrachialis. At this level, which corresponds approximately to the middle of the arm, every nerve at this level, it completely changes its position. Now, the median nerve, which was lateral to the brachial artery, now it crosses superficial to the brachial artery and then medial to the brachial artery, and it stays this way till the level of elbow. In elbow, it lies in a dangerous position. Dangerous position means what? It is very liable to injury. By how it lies in a dangerous position? It lies here in the contents of the cubital fossa, separated from the median cubital vein by the bicipital aponeurosis. So it is liable to injury by a wrong intravenous injection in the median cubital vein. Now, we are finished with the arm. Now we are going to enter the forearm. How does it enter the forearm? It enters the forearm between the two heads of pronator teres muscle in brown here. It becomes medial to it, and between median nerve lies between flexor discorum superficialis medially and flexor carpi radialis laterally. Now we're done with the forearm. So how does it enter the hand? Superficial or deep to flexor retinaculum? You know that everything called ulnar or palmar lies superficial to flexor retinaculum. So the median nerve, of course, it enters the palm deep to flexor retinaculum. Now in the hand, in the palm, it divides into two terminal divisions, lateral division here and medial division here. Now let's go to the branches of median nerve. Median nerve does not give rise to any branches in the arm. Why is that? Because musculocutaneous took the chance first and supplied the muscles of the arm. Now median nerve starts its work from the forearm and downward. So it gives branches, motor branches, to all superficial flexors except flexor carpi ulnaris, which seems to be supplied by the ulnar nerve, as its name implies. Now, downward, just above the wrist, it gives rise to a palmar cutaneous branch. As the name says, I'm palmar, so anything called palmar or ulnar passes superficial to flexor retinaculum. To supply what? Please look at the upper diagram on the right side of this screen. It supplies the lateral 2/3 of the palm. Palmar cutaneous branch of the median nerve, it supplies the lateral 2/3 of the palm. Now, let us move downward. In the hand, the median nerve terminates into two terminal divisions, lateral and medial. But we forgot in the forearm. The median nerve also gives rise to a deep branch. This deep branch is called anterior interosseous branch. Why it is called anterior interosseous? Because it passes in front of the anterior to the interosseous membrane between ulna and the radius to supply the deep flexors except the medial half of flexor digitorum profundus, since this medial half is directed towards the medial side, towards the ulnar side. It seems to be supplied also by the ulnar nerve. So, as regards the superficial and the deep flexors of the forearm, which are 8 in number, it seems that the median nerve supplies 6.5 muscles, leaving only 1.5 muscles to be supplied by the ulnar nerve. These 1.5 muscles are easier for you to know, which are flexor carpi ulnaris and the medial half or ulnar half of flexor digitorum profundus. But in the forearm also, the median nerve gives only one cutaneous branch, which is the palmar cutaneous branch, supplying the lateral 2/3 of the palm. So in the forearm, it seems that the median nerve is mainly motor and only one cutaneous sensory branch. In the hand, the two terminal branches of median nerve seem to follow the opposite plan to the forearm, meaning they only supply 5 out of 20 muscles of the hand. Meanwhile, they supply the lateral here. Just look to the upper diagram on the right side of the screen. They supply the lateral 3.5 fingers in blue here, lateral 3.5 fingers, both on the palmar aspect as well as here down on the back of the distal 2 phalanges or the distal 1 phalanx of the thumb. You can see lower down, this is 1 finger, and the median nerve supplies the palmar aspect as well as the skin over the dorsal aspect of the distal 2 phalanges of the lateral 3.5 fingers, of course. Now, to summarize median nerve distribution, motor will be colored in green and sensory, which will be colored in red. Motor, 6.5 muscles out of 8 flexors of the forearm, except flexor carpi ulnaris and medial half or ulnar half of flexor digitorum profundus. Obviously, these 1.5 muscles will be supplied by the ulnar nerve. 5 out of 20 muscles of the hand, namely the 3 muscles of the thenar eminence, you can summarize them as the abductor pollicis brevis and the flexor pollicis brevis and the in-between opponens pollicis, as well as the lateral 2 lumbricals number 1 and 2. 5 muscles out of 20 muscles of the hand. Let us go to the right side of the screen, sensory distribution. Of course, by the palmar cutaneous branch of the median nerve, skin of the lateral 2/3 of the palm, as well as the lateral 3.5 fingers, palmar aspect, and the dorsal aspect of the distal 2 phalanges. These fingers are supplied by the 2 terminal branches of the median nerve in the hand. As I told you before, there is a sort of balance between the motor and sensory. Let us see in the upper part of the screen here, 1 sensory branch, but the median nerve supplies 6.5 muscles out of 8. In the lower part of the screen, you have only 5 out of 20 muscles of the hand. Meanwhile, the median nerve 2 terminal branches supplying the lateral 3.5 fingers, which are the majority of the fingers of the hand. Now, let us go to the effect of injury. The most common type of injury of the median nerve occurs deep to flexor retinaculum, a condition probably you heard about it before. It's called carpal tunnel syndrome. Carpal tunnel syndrome, due to gradual compression of the median nerve as it passes deep to flexor retinaculum. It occurs in some obese females, around 40. This syndrome is characterized by the position of fat and fibrous tissue deep to, not superficial to, deep to flexor retinaculum, therefore compressing the median nerve. The effects of carpal tunnel syndrome or median nerve injury deep to flexor retinaculum, at least two. Number one, tingling and numbness, and then sensory loss over the lateral 3.5 fingers, palmar aspect as well as the dorsal aspect of their distal two phalanges, which are going to be colored brown like the fingers on the right side in the diagram are colored brown. You can see that the palm is spurred. Palm is normal. Why? Because it is supplied by the palmar cutaneous branch, which lies superficial to, not deep to, the flexor retinaculum. And this carpal tunnel syndrome affects the structures deep to flexor retinaculum. Of course, there is motor effects of the carpal tunnel syndrome. The muscles of the thenar eminence will be paralyzed, will be wasted or atrophied, and this lead to the 5 fingers lying in the same plane like a monkey or ape-like hand or simian hand, which is the race from which we descend. Now, let us see this assessment question. A 40-year-old woman, so it's a female and 40 years old, all right, complained of numbness and decreased sensation in her thumb, index, and middle fingers. These fingers seems to be supplied by the median nerve. The attending physician noticed a flat thenar eminence. Oh, we are coming close to carpal tunnel syndrome, and diagnosed a nerve injury. Which of the following deformities also result from injury of this nerve? Which he is not asking about the median nerve injury. Which of the following deformities also result from injury of this nerve? Oh, let us see. Is it the lateral cord or medial cord, radial nerve, median nerve, ulnar nerve? He is asking about the deformity, which is ape-like hand, so that the answer will be, of course, median nerve. Now, let us see another question. In the arm, the median nerve forms which of the following relations to the brachial artery? Remember which was the relation? At first, was it lateral? And then, what do you think? Lateral or anterior? Lateral, anterior, and medial. This is correct. Now, let us see the ulnar nerve. Ulnar nerve. The origin of ulnar nerve seems to be here. Look at the diagram, please. It seems to be the continuation of medial cord. You know that the medial cord root value is C8 and T1. So how come it is written above here on the left side of the screen C7 and 8 and T1? So C7 has to be transferred to the ulnar. Please look at the dashed arrow here. This arrow says it all. C7 fibers may be transmitted from the lateral root of median nerve, or from the lateral cord, or from the beginning of median nerve. Okay. Now, since ulnar nerve is the continuation of medial cord, now when it is formed on the left, on the medial side of third part of axillary artery. And if you go down, now it is still on the medial side of the brachial artery till the level of insertion of coracobrachialis, where everything changed to the opposite. Now I'm on the anterior compartment of the arm. At this level of insertion of coracobrachialis, now the ulnar nerve, together with superior ulnar collateral in red here, they pierce the medial intermuscular septum in order to be posterior. And they stay posterior till the elbow. Now this is the summary of what I just mentioned, and let us go back to the course. Now let me repeat you again. Now I'm on the medial side of the third part of axillary artery, medial side of brachial artery, till the level of insertion of coracobrachialis. Ulnar nerve with the superior ulnar collateral artery pierces the medial intermuscular septum in order to be posterior, in the posterior compartment. They are represented by these dashed lines, and they stay this way till the elbow. In the elbow, they, especially the ulnar nerve, lies on the posterior aspect of medial epicondyle. This is a dangerous position. This is in close contact with the medial epicondyle, affected or injured by fracture medial epicondyle. We're done with the arm. Now I'm going to enter the forearm. How does the ulnar nerve enter the forearm? By passing between the two heads of flexor carpi ulnaris. Remember median nerve? Median nerve enters the forearm also by passing between the two heads of another muscle called peroneal teres. And this is what I just mentioned. It enters the forearm again between the two heads of flexor carpi ulnaris. In the forearm, it is also covered by flexor carpi ulnaris. But in the middle of the forearm, now it becomes lying between anything called ulnar. See here, lateral to it is ulnar artery. Now, medial to it is flexor carpi ulnaris. Posterior to it is the ulna. Right. How we're done with the forearm. How does it enter the palm? Anything called ulnar, anything called palmar passes superficial to flexor retinaculum, so the ulnar nerve, together with the ulnar artery also, on its lateral aspect, they both pass superficial to flexor retinaculum. In the hand, in the palm, it divides into two terminal branches, superficial and deep here. And this is the summary of what I just explained. Now, the branches. Of course, no branches in the arm. Why is that? I told you before, and I'm telling you again. Because musculocutaneous took the chance first and supplied the muscles of the arm. So the ulnar nerve, together with the median nerve, they share the nerve supply of the forearm, they share the nerve supply of the hand. Anything median nerve did not supply, it will be supplied by the ulnar nerve. Let us go back to the forearm. Forearm, remember, median nerve supplied 6.5 muscles out of 8. So 1.5 muscles will be supplied by the ulnar nerve, which are the flexor carpi ulnaris in brown here, and in violet here, the medial half, the ulnar half of flexor digitorum profundus. The ulnar half, I mean the part of flexor digitorum profundus which are acting on the medial two fingers, the little finger as well as the ring finger. Since I'm not giving here motor muscles as much as the median, so I have the chance to give two sensory branches. So 2 inches above the flexor retinaculum, it gives rise, the ulnar nerve gives rise to the dorsal branch. What is the dorsal branch? You see here that the dorsal branch will curve posterior to pass superficial to the extensor retinaculum. Look at the diagram here on the left, the second one. It supplies the back of the hand. This is the dorsum of the hand, only the medial 1/3, and supplies the dorsal aspect of the medial 1.5 fingers, except the distal 2 phalanges. Why the distal 2 phalanges? You will see in a second. This is the dorsal branch. What about the palmar cutaneous branch of ulnar nerve? Since it is called palmar and it comes from the ulnar, so it is fair enough to pass superficial to flexor retinaculum, and then it will supply what? The palmar cutaneous branch. It will supply, see the second diagram on the left here. It will, the first diagram on the left. It will supply here the palm of the hand, only the medial 1/3, and the palmar aspect of the medial one these 1.5 fingers. Now, what about the 2 terminal branches? The 2 terminal branches will supply what? Will supply superficial and deep. They will supply the remaining 15%, 15 muscles out of 20 muscles of the hand. Now let us summarize the branches and the distribution of the ulnar nerve. In the arm here, number 1, no branches, of course, non-distribution. Number 2, near the elbow, it gives rise to muscular branches to the flexor carpi ulnaris and the medial half of flexor digitorum profundus. Below the middle of the forearm, it gives rise to dorsal branch, runs obliquely, superficial to extensor retinaculum to be distributed to. The skin on the medial 1/3 of the dorsum of the hand and dorsal aspect of the proximal phalanges of the medial 1.5 fingers. Of course, the distal 2 phalanges will be supplied by the palmar, number 4, the palmar cutaneous branch, which passes superficial to flexor retinaculum, supplying the skin of the medial 1/3 of the palm, and it is completed here by number 5, the 2 terminal division, supplying sensory branches to the skin of medial 1.5 fingers on their palmar aspect and their dorsal surface of their distal 2 phalanges, as well as the 2 terminal divisions supply motor fibers to 15 out of 20 muscles of the hand, except the 5 muscles supplied by the median nerve, which are the 3 muscles of the thenar eminence and the lateral 2 lumbricals number 1 and 2. Lateral 2 lumbricals number 1 and 2, these are concerned with the index and the middle fingers. So again, to summarize the ulnar nerve distribution, let us see the left side, the motor in green here. 1.5 out of 8 flexors of the forearm, which are flexor carpi ulnaris and medial half of flexor digitorum profundus, and 15 out of 20 muscles of the hand, except the 3 muscles of the thenar eminence, which are abductor pollicis brevis and flexor pollicis brevis and opponens pollicis, and the lateral 2 lumbricals number 1 and 2 acting on index and middle fingers. As regards the sensory branches, you have the distribution of ulnar nerve to supply skin of medial 1/3 of the palm, as well as the medial 1/3 of the dorsum of the hand. Regarding the fingers, the medial 1.5 fingers palmar aspect as well as the dorsal aspect. And this is the diagram showing that. Just please focus on the light blue color. You will see the branch, you will see the distribution of the ulnar nerve, of course. Motor effects here, it leads to paralysis of the flexor carpi ulnaris, which is in brown, and the medial half of flexor digitorum profundus in violet, as well as 15 muscles out of 20. Let us pick one and one. Since the flexor carpi ulnaris and medial half of flexor digitorum profundus will be paralyzed, so the wrist flexion will not be that severely affected. The patient will have good wrist flexion, but it is associated with abduction. Since the flexor carpi ulnaris is paralyzed, so the flexor carpi radialis will take the upper hand and make some radial deviation or abduction of the hand in each time the patient does wrist flexion. Let us go to the 15 muscles out of 20 muscles of the hand which are paralyzed. Let us pick group by group or one by one. Adductor pollicis. This means the thumb will be abducted. The thumb will be abducted. So if you give a paper to the patient in order to catch it between the thumb and the index, the patient cannot do adduction. Instead of that, it hyperflexes the flexor pollicis longus, which is supplied by the median nerve, which is normal. So the paper will be overwrinkled by this movement. This is called positive Froment sign. Let us go to number 3 here, palmar and dorsal interossei. Interossei, together with the lumbricals, they do what is called the writing position. But also individually, palmar interossei, they do adduction of the fingers, and the dorsal interossei, they do abduction of the fingers. So there will be loss of adduction and the abduction of fingers. The adduction of fingers can be tested by a piece of paper putting between the medial forefingers and ask the patient to just adduct the fingers in order to catch the paper. He cannot, and this is called positive paper test. Number 4, interossei, whether palmar or dorsal, and the medial 2 lumbricals are affected. Medial 2 lumbricals, which are acting on the little finger as well as the ring finger. There will be loss of writing position. What is writing position? Flexion of the metacarpophalangeal joints and extension of the interphalangeal joints. So if you do the opposite of the writing position, Now the fingers will be extended in the metacarpophalangeal joints and flexed in the interphalangeal joints. This is called partial claw hand. Why it is claw hand? This is the opposite of the writing position. Why it is partial then? Because it is less marked in the index and the middle fingers. Why is that? Because the lumbricals of these fingers are normal, since they are supplied by the median nerve. So not all the fingers are affected. The claw hand is less marked in the index and middle fingers. And this is the partial claw hand. You see here on the left side down the abducted thumb. You see here the clawing is marked in the ring and little fingers, but it is less marked in the index and middle fingers. These two fingers are not flexed in the interphalangeal joints because their lumbricals are normal since they are supplied by the median nerve. Let us go to the second level of injury at the wrist. Here, as you can see in the diagram, this is due to cut wounds superficial to the flexor retinaculum across the wrist. Any cut wound will injure the ulnar nerve. Now, the effects of this injury. Let us see the sensory. Of course, the sensory here will be limited only to the medial 1.5 fingers palmar aspect and the dorsal aspect of the distal 2 phalanges. So why the rest are normal? Because they are supplied by the dorsal branch of ulnar, which arise 2 inches above the rest, and it curves posteriorly, and the cut wound occurs anterior to the rest. Let us go back to the motor effect. Motor effect as before, as what happened in the injury of the ulnar nerve at the elbow. But you can see here clawing is more severe. How come? Because flexor digitorum profundus is now intact. As you can see, the level of injury is distal, and the flexor digitorum profundus in violet here already received its nerve supply. And since the flexor digitorum profundus will be acting our normal again, so the clawing of the medial 2 fingers will be more severe because the flexion of the interphalangeal joints will be as normal as a normal person. And this is called ulnar paradox. Paradox means opposite to what is expected. Meaning what? I thought that the ulnar nerve injury will be more severe if it is proximal. But now the clinical picture of the ulnar nerve becomes more severe when we go distally. So this is called opposite to the normal paradox, ulnar nerve injury paradox. Let us, at the end of the lecture, let us compare between ulnar nerve and median nerve. Median nerve will be on your left side, the left side of the screen. The ulnar, this is the median nerve. Ulnar nerve will be on the right side of the screen. Let us see the difference. Median nerve arises from both cords. Root value is everything, C5, 6, 7, 8, and T1, while ulnar nerve is the continuation of the medial cord and receives the contribution from C7. So its root value is C7, 8, T1. When median nerve is formed, it is formed on the lateral side of the axillary artery and then brachial artery. When ulnar nerve it is formed on the medial side of third part of axillary artery and then brachial artery, till the level of insertion of coracobrachialis, where everything it changes to the opposite. Median nerve becomes anterior and then medial and stays medial to the brachial artery till the elbow. The ulnar nerve with superior ulnar collateral artery pierces the medial intermuscular septum to become posterior, and both of them stay posterior in the posterior compartment till the level of the elbow. At the level of elbow, both median nerve and the ulnar nerve are in a dangerous position. Median nerve is liable to be affected or injured by wrong intravenous injection in the median cubital vein. Ulnar nerve liable to be injured by fracture medial epicondyle. Both of them enter the forearm between two heads of a muscle. Median nerve between the two heads of pronator teres, ulnar nerve between the two heads of flexocarpi ulnaris. In the forearm, both of them pass between two similarly named structures. Median nerve between flexor digitorum superficialis and profundus. Ulnar nerve between flexocarpi ulnaris and the ulna, as well as ulnar artery. In the lower part of the forearm, both are covered by skin and fascia here, skin and fascia here. Both of them. Right. Let us see how do they enter the hand or palm. Median nerve deep to flexor retinaculum, ulnar nerve superficial to flexor retinaculum. In the hand, both divide into two divisions. Median nerve lateral and medial divisions, ulnar nerve superficial and deep divisions. The supply of or distribution of each nerve, median nerve 6.5 muscles out of 8 in the forearm, ulnar nerve 1.5 muscles, median nerve in the hand 5 out of 20, ulnar nerve 15 out of 20. Sensory distribution, you can see here the hands. Median nerve supplies lateral 1/3 of the palm, as well as lateral 3.5 fingers palmar aspect and the dorsal aspect of these fingers, dorsal aspect of the distal two phalanges. Ulnar nerve supplies medial 1/3 of the palm and medial 1/3 of the dorsum of the hand, as well as medial 1.5 fingers, both palmar and dorsal aspect. Effect of injury: median nerve is monkey hand or ape-like hand or simian hand. Ulnar nerve, the name of the deformity is partial claw hand. Less marked in the index and middle fingers. Sensory loss here in the skin areas marked by the question mark on both diagrams. Thank you.